Once again, the counterweight, we are not a political podcast, but politics comes into play every single day in healthcare, especially if you're building a company or you're thinking about starting a company. Because of the nature of how healthcare is paid for and delivered in the US, you have got to be mindful of politics and policy for any number of aspects of areas that you may start in healthcare. So first and foremost, I'm not going to talk through every single headline that's coming out of this administration. It's like an avalanche. You can't keep up. That's probably intentional. It wears me out. But here are some of the things that have broken through. One, the administration, and specifically the president, has endorsed a House budget bill that would cut over 10 years $880 billion out of Medicaid. Now, that's a big number. We spend a lot of money on Medicaid, but that's spread over 50 states plus territories. It supports over 80 million Americans. And I've seen some estimates, I've seen some people say that Medicaid covers 1 out of 2 births that happen in the United States. It is almost overwhelming to think about how many people are actually impacted. And I would go so far as to say impacted for the better because of Medicaid providing access and payment to healthcare services, and not just hospital and not just primary care, but dental to behavioral health to specialty services, etc. So whether or not you like Medicaid or not, whether or not you agree with what this administration is doing or not, what you do need to be aware of is that there is a train coming down the tracks that is continuing to build steam to take a lot of money out of these programs, which means that these programs are going to get smaller. It means that states are going to be more responsible for the amount of money they spend, which in many cases is going to mean that they won't spend money on these programs. And if you're building companies that focus on that population, an underserved and important population, then you've got to be thoughtful about what your financial model is, because if you're dependent on federal funds flowing down into these programs, you're going to come out on the short end of the stick if you're not thinking forward to other alternative financing mechanisms as you build your business. Now, that being said, I hope that this changes course. I've seen the benefits that people derive from having access to healthcare, especially the populations that typically are receiving care from Medicaid. You may not be aware, but Medicaid is one of the greatest innovation engines in terms of new healthcare delivery mechanisms within the United States. It's a great tool for experimentation across all of these different states and how you can do more with less, if you will, but remains to be seen.